Thank you for the time. I've got 10 minutes. Just a quick overview in terms of the scholarship of engagement at the Faculty of Dentistry. Good afternoon, colleagues. I'm Yengopal, and thank you for allowing me to give you a brief account. Let me first provide a bit of a context and a background to the problem of dentistry and the importance of dentistry in both the country and in the Western Cape per se. Almost half the world's population suffers from oral diseases, so this is quite a common disease. Although it's not life-threatening, it certainly impacts on terms of the quality of life of the people it affects. 2.5 billion adults suffer with pain due to untreated tooth decay and permanent dentition. About 600 million children suffer the same fate in their milk teeth or primary teeth. There are about 300 million people that don't have any natural teeth due to edentulousness, which is people that don't have any teeth in their mouth. And Western Cape has one of the highest rates of edentulousness in the world. In this province, 82% of children under the age of 6 have tooth decay, and more than 90% of this remains untreated. And the importance of the Faculty of Dentistry in the context of oral health in this province cannot be underestimated. Of the 260 chairs that we have for service in this province, 200 of them operate on the UWC or the University of Western Cape platform. So we certainly play a significant role in terms of service delivery and engagement with communities on a daily basis. So because oral hygienists and dentists are amongst the highest occupational risk in terms of COVID infection related to the nature of the work that we do, and stuff like fillings and drilling, that generate these aerosols that are generated during dental work, and these aerosols carry these virus particles. So, and these poses a significant risk of transmission between patients and between patient and operator. Many of the public facilities during the COVID pandemic were closed because they were unable to become COVID compliant and ensure the safety of patients during this time. So this meant that people had restricted access to services, and it became important for us to implement these outreach programs in communities that focused on prevention and oral health self-care interventions that could be practiced at home. In that way, keeping patients healthy in an era where access to services were severely restricted. So the faculty's two key departments, that was community dentistry and the oral hygiene department, had to restructure their activities to focus on prevention and education type of activities that could safely be implemented at sites where people live the work. And some of these activities we will be highlighting in the presentation here today. So one of the sites is the Pambili Community Development. So this is a non-profit organization that operates out of the Heartlands Baby Sanctuary, which is a residence for HIV positive children in Somerset West. And what you need to know about HIV is over 60% of the cases, the first sign of symptom occurs in the mouth. And when it occurs, it significantly impacts on the quality of the lives of these kids. So the oral health teams play a major role in terms of prevention and managing these patients. The team comprised of both students and postgraduates, and they provided oral health education, screening, and the preventive interventions for both the children and the cases of these sites. I think the other thing that you know or need to know about dentistry is one of the most expensive professions to train from a healthcare perspective, and one of the most expensive services to deliver at a very primary healthcare level. The other project that I just want to highlight is the collaboration that we have with community health sciences and dentistry and training. And this was an interdisciplinary community outreach project. And the good thing about dentistry is we are often not seen as a threat when it comes to projects. We often piggyback on a lot of other projects, and we can add value to these sites. And I think community health sciences also acknowledged the importance of this multidisciplinary collaboration. And our students, both oral hygienists and dental students, over a period of a couple of days, were able to provide a range of services such as extraction, scaling and polishing, supervised brushing, oral health education, and fluoride varnishes to the community in that area. Another quick project that I just want to highlight was this project that the Kambu Bantu, which is a non-profit organization. This is basically an educational organization that basically provides education for principals and teachers of early development childhood or ECD centers. And they have a health component, and this is where the collaboration and the piggyback comes in, where we got involved by providing dental services. And as you can see on the screen, we had a whole range of activities. There were over 1,500 children that participated in these brushing programs. The patients received having a variety of treatment options, just cutting, scaling, and polishing, etc. Another important area that we in dentistry are getting involved in is the special needs. The big problem with the special needs is access to care. Most of these groups, such as autistic kids and kids with cerebral palsy, etc., have major problems in terms of accessing healthcare. And the problem with dentistry is you can't just take these kids and put them on a chair. They're required to go to theatre. And the problem with theatre is because dentistry is not regarded as a priority, these kids often have to wait for 6 to 7 months before they are seen on the platform in theatre. And can you imagine the pain and suffering that they have to go through? So the focus on prevention and education cannot be underestimated. So there's a long-standing project that's been initiated by our students working in various centers that deal with these types of kids and adults. And it involves the education of school teachers, fluoride treatment for the children, and brushing programs. And there's a whole range of other activities that we also engage in terms of spreading the word and the education, in terms of magazine articles, giving education on radio shows, etc. And ultimately, the message was the importance of keeping the mouth healthy in a time where access to care is problematic because of the dangers, the limitations in the COVID era. So the long and the short is the impact and the response and the demand to our treatment has been of such a magnitude that we have realized that we can now actually move our outreach and our impact to the next level. We've raised sufficient funding with help from the Rotary Club and from the university, and we've developed this state-of-the-art mobile dental clinic, which is fully digital. So basically, the idea is to mimic what we have in the hospital, and we can take it out in a community-based setting. So if you look at health training in general, there's a big trend of moving training out into the real-world settings where communities live, so that when students make clinical decisions regarding treatment care, they can take into account the social determinants of health in their clinical decision-making, so that when they make clinical decisions regarding treatment needs, the decisions are based on the limited resources and taking into account what the patient can and cannot afford and the resources available at that current time. So this is a new era, and the other thing that we're focusing on also is making sure that the work that our students do in the community counts for the sort of quota or competency requirements in terms of the requirements for training. And I think all the top schools in the world are going in this direction. I think we're producing a student that can be locally responsible and globally competitive. And in South Africa, we are blessed. I won't say blessed in a positive sense, but we are blessed in the sense that we have a huge burden of disease, and we can give our students maximum exposure to all this the technical training that will make them compete at the very best in terms of their competitors, both locally and globally. Thank you for that.